Hello, this is Dr. Alexander Haskell again, and this time we'll be discussing the importance of labs testing. And in the beginning of discovering Hashimoto's, you will have done, most likely, the two antibody tests, which are called TPO antibodies and also for the antithyroglobulin antibodies. But at the outset, it's also very important to look at a few other lab tests, other parameters which are also involved with the optimization of thyroid hormones, the utilization of the hormones, and also production of these hormones. So I always recommend that besides having current lab results for these antibodies, and also to some extent the rest of the thyroid panel, which has to do with total T4 or T4 and free T4 and free T3. These are not essential in getting started with the treatment of Hashimoto's, but it just adds another perspective on where a person is in the beginning of treatment. But the other lab tests, which are also important to give additional information, which can be very useful and can initiate certain important approaches of treatments, would be iron. Primarily the lab test to be using is to assess the whole body stores of iron through a lab test called ferritin. Ferritin stores are important because when the body needs iron, such as for fighting infections, and such as for if there is some blood loss to improve the amount of hemoglobin inside the red blood cells. And also iron fulfills an important role in a particular enzyme in the thyroid cells, which is essential for producing thyroid hormones. And eventually the treatment for Hashimoto's will come to a point where we are going to see how well the thyroid can start producing its own thyroid hormones once again. We want to make sure that the thyroid is ready for that next stage after getting antibodies down. The other important tests are for vitamin D for a number of reasons, which I won't go into right now. Also checking liver enzymes to see if they might be elevated. The liver plays a very important role in thyroid hormone metabolism, or the conversion of the inactive T4 into the active T3. And if liver enzymes are elevated, much beyond 20 or 25, that's AST and ALT, then that needs to be addressed now so that when we reach the second stage, we will have better conversion of T4 to T3. We also want to know levels of cholesterol. Cholesterol is extremely important for the nutrient, the building blocks for your body, your glands, the ovaries, the testes, etc., for the optimal production and balance of various male and female hormones. The most important one, I would say, is also cortisol produced by the adrenal glands. Cortisol plays a vital role in health and with the immune system and with regulating blood sugar and various things such as that. So cortisol and progesterone and estrogen and DHEA and testosterone, all those hormones require to be made optimally, require cholesterol. And anyone on lipid-lowering drugs and your lipids, your cholesterol is lower than about 180, you must really consider getting off that medication to keep your cholesterol levels optimal so that your body has the nutrients it needs to make the right balance of hormones. I also suggest checking the cortisol levels, the estrogen and progesterone. Progesterone plays a very, very important role in thyroid hormone production. There are actually progesterone receptors on thyroid cells, and when progesterone contacts those receptors on thyroid cells, it will increase the production of thyroid hormones, and vice versa. Thyroid hormones, or there are thyroid receptors on the ovaries, and thyroid hormones, when they come in contact with those receptors, will tell the ovaries to produce more estrogen, more progesterone. So then as we progress after a person has started their medication, their thyroid medication, and over the first month, monitoring symptoms and the person receiving advice on when it's time to increase the thyroid medication. Then at that point, after about a month, 5 weeks, somewhere in there, a next lab test is done to measure really only two things at that point. Our main concerns are that the TSH levels are coming down and that the antibodies are also coming down. And taking sort of a little snapshot of those two values gives us a pretty clear idea about how well the person is responding to the thyroid medication and also to the various nutrients that we're providing to reduce inflammation, and also to know that they're following the diet, avoiding iodine and also avoiding gluten. So that's about 5 weeks after they start the program. There's a lab test done then. Depending upon how high their antibodies were and how high their TSH was, we'll get a little bit of an idea. Now we have two dots we can connect to give us an idea about their progress and to then sort of look a little bit into the future to determine then when we would do our next lab test. It might be a month later, and it might be 2 months later. At that point, we have no idea when the next repeat of the TSH and the T4 will be. Sorry, TSH and also the antibodies. So eventually, the lab test, when their antibodies are down and the TSH is down, at that point, we then need to find out how well their own thyroid is working, and also how well they're converting T4 to T3. And at that point, we know TPO antibodies are down, we know TSH is down. We need to find out how they're doing with their T4, the free T4, and their free T3. And that will determine where their baseline is, how well their thyroid's doing, and also how well they're converting. Around that same time, we start to introduce iodine. And this gets a little bit, we need to use a little bit of caution here because everything else is all set. The platform is there. The selenium, the glutathione, all the thyroid needs to make its hormones are in place. When we put a little bit of iodide into the system and starts that mechanism of making thyroid hormones, we have no idea how efficient the thyroid is in making these hormones. And remember, the person is on thyroid medication. So if their thyroid starts making hormones and they're on medication, then they could start to have symptoms of excess thyroid hormones or hyperthyroidism. So again, when we start introducing iodine, it's extremely, extremely slow. We usually use a combination of iodine and potassium iodide in a Lugol solution, and we're talking about 1 drop diluted in a glass of water and taking a tablespoon a day to start with. We're watching for any signs of elevated thyroid hormones, such as feeling restless or a rapid heartbeat, obvious symptoms or signs that people have. If that happens, it's very easy at that point to start to reduce the thyroid hormones and finding again that equilibrium between the thyroid's production and taking something by mouth. It's a very exciting time for a lot of people. They realize that they're feeling better, they have much more energy, and now their thyroid is starting to kick in with some of its own production of thyroid hormones. At that point, we can also throw in some other nutrients like higher doses of vitamin A, which will help to help the thyroid gland and also pituitary to work more effectively. Before, I don't recommend things like vitamin A because it can stimulate the immune system, and we don't really want to do that very much with an autoimmune condition. So I think that just about covers it, and next we'll go on to another topic related to thyroid hormones. Thank you.